Because the proposed American Health Care Act, AHCA, that was passed last week in Congress, allows states to ask for waivers for pre-existing condition limitations, the bill also contains some structure for reestablishing health risk insurance pools or high risk insurance pools. I hear both. In Wisconsin, we used to have a plan before the Affordable Care Act called HIRSP. And that can give us some good hints as to the kind of high insurance risk pool that Wisconsin might set up and allow. So HIRSP was really a last-ditch effort for people who were uninsurable. There were people with pre-existing conditions, anyone with a disability, anyone who had had cancer, sometimes even people who had diabetes. We weren't able to get them covered under health insurance that would cover those conditions. So HIRSP was a last-ditch effort to get them some sort of coverage. And it's a complicated funding structure that has to do with premiums and the government, which I won't go into. But the bare bones of what you need to know about HIRSP is that it was extremely expensive for most people, sometimes half of monthly income. And at that time, insurance was less expensive and care was less expensive. HIRSP also often had 6-month pre-existing condition limitations, so they wouldn't cover people for 6 months, even though it was technically a kind of public-private quasi-insurance. You had to pay premiums towards the plan for 6 months before you could even get coverage for any of your pre-existing conditions. So that's what existed before. If, in fact, the American Health Care Act, AHCA, does pass the Senate and goes to the president's desk, we would see a reestablishing of these high-risk pools. Whether or not that's a positive thing, you can make a decision. I can tell you, working with thousands of people on disability and trying to get them insurance, HIRSP was incredibly expensive. It's a group of, the risk pool is a group of people who are otherwise uninsurable because their risk is too great for an insurance company to insure them. And they're all put in a pool together, and the premiums they pay goes towards the cost of care. And because they're in this pool, everyone's premiums contribute to everyone's care. So it can be incredibly expensive when you have a group of high-risk patients, folks with cancer, with severe diabetes, with other severe disabilities, all getting a high level of medical care, and there's only unhealthy people in the pool paying premiums. Right now, under the Affordable Care Act, for good or bad, you be the judge. There are a lot of people, healthy and sick, in these insurance companies, so it creates this pool of people who, some get a lot of care, some get very little care. There's people like me who only go to the doctor a couple times, are fortunate enough to only have to go to the doctor a couple times a year. So I know that my premiums are helping to support someone else who has a disability and needs to go more often per year. So the proposed changes get rid of our current structure where everyone is contributing towards the care, and change it so that healthy people go into one pool and sick people go into another pool. So that's the proposed change.